You're listening to The Mark Cox Show. Find everything Mark Cox at 971talk.com/Cox.
It could still happen if the people who wrote the bill are willing to negotiate. Conservatives want a repeal bill. I want a bill that looks like, feels like, and is a repeal bill. My fear is when I look at this, I keep reading it, and it's like, it sounds like Obamacare to me. It doesn't even sound like Obamacare Light. In some areas, it may be Obamacare Plus on the subsidy side. We can't have a bill that spends more than Obamacare in the first couple of years and call that a repeal bill. So, yes, we should be for repeal, but we also have to have sufficient confidence in capitalism, competition, and free markets.
That is Senator Rand Paul, obviously, who's got some concerns with what's going on with this new health care bill. And we told you some of the details on it. It obviously spends a little more money than the House version would have. Is it an improvement? I don't know. Does it repeal most of Obamacare? I think that it does. Rand Paul doesn't like the fact that it still sends a lot more money to private insurance companies. I've asked Dr. Elaina George to join us today. She's a physician we've had on the show a number of occasions in the past talking about Obamacare. Dr. George, how are you?
I'm fine. Thank you for having me back.
Oh, great to have you back. Have you had a chance to look over this draft of the Senate version of the American Health Care Act?
Yes, I have. And I was kind of disappointed, to tell you the truth. I mean, this is my problem with the whole exercise. We're having a conversation about health care, about insurance coverage, but there's no conversation on how we bring down the cost of health care. And everything that they've done and put into law has exacerbated the problem. I still see patients who can't afford to pay their deductible. They're still denying themselves treatment because they can't afford it. It's not working. That's the bottom line.
Rand Paul called it not Obamacare Light, but Obamacare Plus. He's clearly unhappy with it, but it does remove some of the mandates that I felt pushed up the cost of insurance. It does set aside some of the high risk folks into pools where not everybody's having to pay for their extraordinary conditions. Is that not going to, in some level, bring down the cost for insurance?
No, it's a shell game. So now the taxpayers are on the hook to pay for those pools of money. I mean, they have two pools now. Instead of just giving money to the insurance companies as their bailout, now the states get a pot of money as well. Where's that money coming from? It's coming from all of us.
Sure.
Ultimately, the community rating is still in effect, which is ridiculous. Why should they get the same amount of money, whether or not they have a medical problem? That doesn't make sense. It jacks up the price for everybody. And there's, from a apples and apples perspective, when people hear the word pre-existing, everybody thinks it's somebody with cancer and some catastrophic condition. That's not what pre-existing really is. It's somebody who's been diagnosed with high blood pressure or diabetes, is on a medication, who is well controlled and has no other problem except they have a diagnosis. That's what they've been conflating to make it seem like these guys are going to be thrown off, they're going to die. That's not what's going on at all. What is happening is the insurance companies are now practicing medicine. They're denying care, they're taking premiums and deductibles, and they are denying care. Here in Atlanta, Blue Cross came up with a plan to deny coverage for ER visits if they deem that they're not emergency. When is this? I mean, doctors don't get a chance to say what the diagnosis is and why the patient should be there. This is the state of medicine as we now know it on the front line. And all the conversations about coverage and kicking people off are irrelevant because people are being kicked off or they're already self-rationing.
I'm trying to get my mind wrapped around the solution then. If they get rid of the mandates, they get rid of the taxes that were raised, they go back to more of a system that like the one that we had, but you're still going to guarantee coverage to people with pre-existing, and you're still going to insure kids to 26 if they're living with mom and dad, because those seem to be two things we can't get rid of for some reason.
Yeah.
Where would you go from there? I mean, if Dr. George got to write this termination of Obamacare, what would it look like?
I wouldn't terminate it. I don't think it's possible to do that anymore. Our healthcare system has been damaged to such a degree. Just withdrawing Obamacare doesn't change the problem. We still have not enough doctors in rural areas. We don't have hospitals in community hospitals or rural hospitals. That's the problem. But what I would do is let that stand and create a free market friendly legislation. Here's what I would do. I'd do 4 things. Mandate price transparency for any healthcare-related entity so that people can become consumers and know what the true cost of their healthcare is. The hospitals and the pharmaceutical companies get away with telling you what it is and not giving you a choice or making you think you don't have a choice. I'm going to tell you as an ENT, I can take a patient and do a surgery, a tonsillectomy for $2,500 for the entire case, anesthesia, OR, my surgery fee. And that same patient, if I took it to the hospital in my community, it's almost $10,000.
Wow.
That's ridiculous. And if people knew, hey, if I go to the main hospital, it's going to cost me $2,500 for a CT versus $250 if I go to an independent CT location, which one would they pick? And what do you not think that would put pressure on the hospitals to stop playing games with their facility fees that jack up the price, and you don't even know that you have them until you get, hit with the bill. This is what's going on. It's just they get away with it because nobody knows what the true cost is. That would change a lot of what goes on in our healthcare system. Health savings accounts, right now, they're locked with insurance companies. So if you have them, you can put money in, but if the insurance company says you can't have a procedure or medication, you cannot use your health savings account to go around them. That doesn't make any sense. It should be unhooked from insurance so you can put as much money in a health savings account as you deem that you want to, and it can be used for any healthcare-related issue, natural care, going out of the country, medical tourism, whatever you want. Why can't you control your money? That's my question. And you should be able to pass it as well to your children or share it with your spouse, whatever. That's the second thing I would do. The third thing is I would make the insurance companies bear some risk. Right now, they're literally practicing medicine. They are going around the medical specialty societies and deciding what constitutes standard of care. It's completely unacceptable. So when I ask for approval to do something that I know is allowed under a good practice of medicine in my ENT society, insurance company can come back and say, it's experimental, we're not covering it. Well, when my patient has a bad outcome, they should be on the hook for it. And I can tell you it would stop immediately with them denying stuff.
Right. Yeah, that makes a lot of sense. Let me ask this real quick. By the way, we're talking to Dr. Elaina George, who's an ENT specialist in the Atlanta area. I heard somebody say the other day that it might have been Charles Krauthammer, that he truly believed that we were on a path to a single-payer system in this country, which frightens me in one sense. And I believe that when Obamacare was ingrained into our system, and it's been there for 7 years, people now have the perception that they have a right to this kind of coverage or that kind of coverage. What's your position as a physician? Because the likes of Chuck Schumer would like to have a single-payer system where you, Dr. Elaina George, are put on a salary so he can control what you make. He thinks you're the reason that health care costs are too high.
Yeah, well, doctors are only 7 cents of the healthcare dollar spent, so it's not the doctors. But I agree with Dr. Krautheimer. I think, and I've written about it, I think this is a faster way to single payer the House bill. And I'm going to just tease that out a little bit. It's not the standard single payer that everybody thinks of, like the UK and Canada. This is a corporatized single payer. So my thing is, I think they're going to try to empower the insurance companies by paying them subsidies, just like they did with TARP. Remember that?
Right.
How they're supposed to give the banks the money and they're supposed to dole it out to the people.
Mm-hmm.
Well, they're going to want to do the same thing, and that's what the Senate bill does. It gives them money in a pool that they're supposed to use to bring down the cost of premiums and deductibles. Good luck with that. It's not happening. What they're going to do is they're going to keep the money and they're going to continue to deny care because nobody's watching them. And that's my version of single payer. It'll be an advantage, a Medicare Advantage type of system. The government gives taxpayer money to the insurance companies, lets them, deliver the services, and they get money for administration. That's how it works. That's how this single payer will work. For those folks who think they're going to get something free and everything's awesome, I unfortunately have bad news for them.
No.
They're going to be on the hook for hospice and denial of care and, the lowest common denominator to keep the money in the pot. That's where we're going if we don't take a stand and take our power back.
I hope someone's listening to you. Let me direct people to your website, drelainageorge.com, where they can find out more about you. And I know you're a regular on a radio program. And Dr. George, I appreciate your insight.
My pleasure. Thank you for having me.
Thank you so much. That's the ground level view of it. She's afraid of what this health care plan might do beyond Obamacare. But she and I would part ways on the fact that they need to keep Obamacare and figure out a way to fix the insurance companies. Here's what I've said from the beginning, and you've heard me say it before if you listen to this show very often. We never needed health care reform. We needed health insurance reform in this country, and we still do. And if we had fixed the health insurance problem, as she's so beautifully described there, we wouldn't have the health care problem that we have in this country. The priorities are completely screwed up. And I don't know if this fixes. I don't know if the Senate bill fixes this or not. I agree with a lot of what Rand Paul's opposition is to this bill, and we can talk more about that. I want you to hear a little more from him, and I'm going to update you on